everyone. We're here for one more week of an episode of the GLANZ Wellness Podcast. So this episode I'm super excited about because we have guests today. We have guests coming all the way from Maine. They're two of my good friends and they're med spa owners. So I'm gonna introduce them and then I want them to talk a little bit about, who they are and what they're doing in Miami this weekend, which is the most important part. So I have Kimberlee Smith first, who is a nurse practitioner in Maine, and she's the founder of Coastal Aesthetics. Yes. So welcome for coming.
Thank you. Thank you so much for having me.
And then I also have Dr. Jennifer Freese, who's the founder of Penobscot Medical Aesthetics, also in Maine.
Yes.
Welcome, Jennifer. Okay, so what are you doing in Miami?
Here to see you. No, but we're actually just kind of coming down, escape the cold up in Maine, check out your beautiful office. We've been so excited to come see you. So we're excited to be on the podcast.
How cold is it there?
20s.
Yes. Oh my
Very
God.
chilly.
I would die. This Puerto Rican ass would die. So let's start with the most important question. Tell us who you are and how long you've been in business.
So like you were saying, my practice is Penobscot Medical Aesthetics, and I've been in business almost 6 years now. We're in kind of small town Maine, and we do injectables and lasers and different devices like that.
And I'm in southern Maine, so Maine's a very long state, it's about 8 hours north to south. So Jen's about 3 hours north of me.
Okay.
So I'm very southern Maine, about an hour north of Boston, and been open going on 7 years. Full aesthetics, laser, wellness, body treatments, hormones, doing some weight loss programs right now. But we've been growing for the past couple of years up in Maine. There wasn't a lot when we started. Certainly there's been some growth over the last couple of years, I think since COVID, but we both have really good control over opposite ends of the state.
I love it. How did you guys meet?
We met at Kim's office, her old office, the first one she had for an allergy training.
Okay.
And I walked in and
I thought she was the model.
Which means she thought I needed filler, right? I mean, which I probably did.
Oh, this girl doesn't need anything done.
Yeah.
And we did. We kind of hit it off. We both were very new in the industry, and it can be a lonely industry. You go from the hospital where you have colleagues and you have, several backups for questions, and we were by ourselves. This was a great opportunity for us to kind of connect business-wise and then friendship-wise.
That's awesome.
Yeah.
So you've been friends for how long?
7 years.
Yeah.
7 years.
Yeah.
Amazing. Okay. And then I'm going to tell you how I met them. So I met Kim at an Alma event. So Alma Lasers has these events throughout the states, and then we met there. And we have been very good friends since then. And then I met Jennifer through Kim. And I can tell you, I meet a lot of people like traveling, you guys know because you do the same thing. We meet so many people around the industry. And even though it's an industry where you get to talk to a lot of people, it can be a little bit intimidating just because we're all females, you know how females think, we love helping each other, but at the same time I feel there's like a little competition aspect where guys don't have that, So for me, like meeting them, and they've been wonderful to me, and developing this friendship when we're so far away, when we talk on the phone so often, was like very special to me. So we're gonna start with key questions. This podcast is gonna be about being entrepreneurs, how we open each of us our med spas because we did it very differently, and kind of like very important topics if you are thinking of opening a med spa or you are in the med spa business but you want to expand or grow or kind of like do things outside the box. That's why we're here. This podcast episode is for you. Let's start with the first question. What inspired you to pursue a career in the aesthetic industry? And then tell us a little bit of your background of where you were at before.
Sure. I am board certified family medicine physician, so I was doing hospital-based outpatient practice for 11 years. And then the last couple of years I was doing both, is when I opened my practice and I was doing both. And so I think what prompted me to go into aesthetics was what I loved about family medicine was the continuity of care. I loved getting to know my patients. I loved having that time with them, and it was slowly being taken away from me. You know, the appointments had to be quicker, and there were more things that you needed to cover, and I really felt like I was starting to miss the whole reason that I got into medicine and family medicine. And so I thought I had an interest in aesthetics for myself, receiving the treatments, and I'm like, this is something that I am really interested in receiving. I might as well learn some more about what it's like to be the practitioner in that scenario. And so I got to spend more time with my patients, really get to know them, have the continuity of care that I was missing in my primary care world. So then about 2 years ago, I stopped doing primary care medicine, and I am just doing aesthetics.
Okay, that's amazing. And then how about you, Kim?
What brought me into it? So I did nursing for about 6 years, went back for my nurse practitioner license, worked in urgent care, and I liked it. But similar to Jen, within 2 years, I quickly realized I wasn't able to practice the way I wanted to. I had to kind of follow guidelines and insurance and jump through the hoops, and I knew what my patient needed, but I couldn't do that. I couldn't give that to them every time. And I started receiving treatments myself. I was in my later 20s, just had my first daughter, and realized I really liked that type of connection I felt with the provider when they were injecting me. So as a nurse practitioner, there maybe was one other in our state. Other than that, it was plastic surgeons, dermatologists, physicians. So I wanted to kind of pioneer the way for nurse practitioners, be able to spend a little bit more time one-on-one and not have the patient feel like surgery was maybe what was being pushed on them. It was okay to do a non-surgical approach. So that's kind of why I got into it.
And that's a great point, because we see a lot of physicians or nurses kind of getting burned out in the hospital. They're trying to find a career where they can move out of there, not because they don't like the setting, but because it's something where they feel exactly that. They can't connect with their patients. Everything's fast-paced, where you're there, you provide the service, okay, bye. I don't have time to even know anything about you because there's no time because of insurance. So that's a good point. I know a lot of like our viewers are thinking, you know, how can I change this? I loved endocrinology, I still love it, but for me, my quality of life was so much more important than just, you know, let me just talk to a patient for 5 minutes and that's it, you know?
And the other part of it too is the patients are happy to see you, right?
They want to see you.
They want to see you, they're happy to be there, you're making them feel better, they're improving their confidence, their appearance, all of those things. And so it's uplifting, like it's rewarding in that way that you really feel like you're making a difference, which you don't always have that feeling, at least in primary care.
Absolutely. I used to say at the ALMA conferences, as an endocrinologist, I was curing your sugars, taking care of your diabetes. I didn't get one single box of chocolates, nothing. And then now in aesthetics, it's like people invite me to their weddings and all these things. You see patients and they're always so happy.
They
so
appreciate you
so much. Okay, and what has been the most surprising or unexpected aspect of working in the aesthetic industry for you?
What's been surprising? I would say, again, in the beginning, I had this loneliness and I thought I made a mistake. What am I doing? I'm by myself, I'm pioneering the way. And I would say making a friend and having someone that wanted me to succeed because they were also learning from my mistakes and vice versa really helped kind of grow this network of positive supporters. The competition that can sometimes come out of this industry is difficult. I think Instagram, I think there's an idea that people need to have this huge following and they need to, you know, have influencers, and those might be good things in your industry or in your area, but I think that the competition can be a lot versus finding people that you can surround yourself who also want to elevate you, but also grow and learn together as kind of a whole and for the aesthetic industry.
And I feel sometimes if I have a question, like I feel like, who am I gonna call? You know? I can call people around me because they're not gonna wanna tell me just because of the competition of, okay, you're in my area, I'm not gonna give you my secret. But that's why for me, our friendship has been very important because, I mean, not only because of that, of course, but I feel I have that backup of like, okay, let me call Kim or let me ask Jen, like, how do I do this? As a business owner, it's even more than going beyond a treatment. It's like, okay, I need to pay my staff. What is your recommendation of how do you pay your staff? Do you collect tips? I think we talked about tips in the aesthetic industry. How do we do things as an entrepreneur? Because as medical providers, you don't get that in school. It's like you get medicine stuff and that's it.
Yeah. Well, and that's what I've said. I'm like, I'm a very good physician. I knew nothing about running a business.
Right.
You don't get that in medical school. There's no training on how to run a business at all. And so it's very daunting. Like you know medicine and you know what you're doing, but after that, it's intimidating to start fresh.
Yeah.
There's no protocol, there's no algorithm,
Nothing.
you're really kind of
Yeah.
figuring it out
as you go.
Yeah, I remember when I wanted to open in Tampa, I was like, okay, let me Google what permits do I need, what insurances do I need, and there's no books. Well, you know what? We should write a book.
I know.
We should totally write a book. That's coming out soon.
Don't steal our idea.
Yes.
Trademark.
How about you, Jen? What was kind of surprising or unexpected when you started that you say now, like, I never thought this was going to be like this?
Well, I think for me, it's a little different because I am in such a small town, and Maine in general has a small town vibe. And so I was surprised at how successful we've been able to be. I mean, I know that sounds crazy, but I'm just continually caught off guard by the demand for the services that we offer. And in the beginning, I've definitely, even in the last few years, noticed a progression of where people are a little more willing to be forthcoming with what they're having done. But for me, it was just, well, I want Botox and I want filler, but I don't think anyone else really gets it, because no one was talking about it. So that was surprising to me, is that at least for our area, I was pleasantly surprised at the number of people that had the same interests and concerns that I did and were willing to kind of get these treatments. That's been the biggest surprise for me.
Wow. And I think it's growing even more. Like, I feel when I started 2016, I look at how many
Medication will take us, because things that happen in Miami might not work well in Maine, and vice versa. And knowing where I want my practice to go. I didn't have a mission statement. I didn't have like a 5-year plan. It was like, I have a 5-day plan. Like, we need to make it for 5 days and then 5 weeks and 5 months. And so I would say the struggle was figuring out which direction and then staying true to it, and not getting caught up in what your neighbor might be doing or the place down the street, and saying, you know what, no, if that's not something I want to do, I'm not going to do it. We aren't a huge injectable or filler practice. I do a ton of laser. I love laser. It truly is a passion of mine. I connect with it. I'm very comfortable with it. Our patients love it. But the practice down the street that is very injectable driven, sometimes I find myself getting pulled in, and I'm like, nope. There's a time and a place. Stick with what your morals are, or what our mission statement would be, what we want our end goal to be, and then stay in that direction.
And I feel that makes you, in some sort of way, stay relevant, right? Because if people know you for a certain product or a certain treatment, they're gonna know you're the best, and that's when they want to go to you. Yes, it's like here we offer a lot of services, but our niche is lasers. So I feel you can have, between the med spa world, you can have your passion for one thing. I don't feel you have to know everything. You can start slow, start with what you like, and then start growing from there. I think when I was in Tampa, I was adding 1 service every year because I was like, this is a lot.
Yeah.
Here, I started with like 30 services because I already had the experience. But I think as an entrepreneur, we get into different journeys in our lives where not only we use other people's mistakes, right, to like guide us of where to go, but also kind of like know what our passion is. Because when you start, like most of the time, most practitioners start with like injectables. Okay, let me see, Botox, do I like it? Do I not like it? Now it's like, I love injecting, but I love so much more doing a laser treatment. So,
And I think that translates to your patients too, right?
Absolutely.
If you know that this is what you're passionate about, then you're going to speak passionately to them about it, and they're gonna want that service because they know that you believe in it and that you're good at it, and I think that they appreciate that, knowing that that's something that you feel that strongly about.
100%. If there was one thing you could change in the industry, what would it be?
I think the trend of kind of the overdone appearance. We go to these aesthetics conferences and sometimes I'm like, I don't belong here. Like I haven't had filler in 2 years, like things like that where the trend has, like the pendulum has swung to kind of that overfilled look. So that would be what I would change.
One thing I would change in the industry, yeah, I would say just support each other, and be educated, spend the money, spend the time, spend the years, spend the, quality control on yourself to make sure you are a safe laser injector, boss, coworker, and that's what's going to be safest for the patient. And I feel like when the patient experience elevates due to safety and good results, then the whole industry as a whole elevates. And that's why we can talk about it openly. It's not taboo because we know now you don't inject some things or do inject some things. So I'd say that's my,
Well, great. That's
Yeah,
a
I
good
wish
one.
we could move away from the idea of the competition over helping other people
Yeah.
out. Because
Mhm.
ultimately, if we do help each other out, it's only gonna elevate the practice and the business in general, and it helps us all, right? I mean, we do get caught up in like, well, I don't wanna tell them my secrets, but, like you were saying, having a, safe and well-done lasers and well-done filler, it just elevates the whole practice of aesthetics, and ends up helping all of us, truly.
Absolutely. Okay, so this is a good one. I want funny stories. Can you share some success stories of 4 transformative experiences from your clients that highlight the impact of medical grade beauty services on their lives?
So I would say, like, transformative wise, we had a teenage patient that was doing self-injurious behavior and had been cutting her arm. So she had lots of scarring on her arm. She was
Wow.
very embarrassed by it and ashamed about it. And so just doing treatments to help with reducing the appearance of her scars was huge. And
Amazing.
yeah, I mean, mom was crying, patient was crying,
Wow.
like gives me chills just thinking about it.
That's a life-altering event. Like, for you to change someone's lives, that's not only changing how they look, but it's changing their mental health. Because
Absolutely.
that can be something that can remind you for years of traumas and past. And wow, that's amazing.
Yeah,
I love that one.
I'd say, those are really impactful. And then kind of like your classic melasma patient, post-pregnancy, this woman felt so beautiful and then she developed melasma and all of a sudden not only has the hormones of a new child and all of that, but her appearance changed. And that can be very, very difficult for a woman to deal with. So working with those patients to improve and to brighten and to work on that and educate them on how it happened. They did nothing wrong.
Right.
This is just hormones in the situation, and letting them be able to wear, not have to wear makeup and go out and take family pictures. So working on their appearance has been a dramatic thing. I think up in Maine too, we see a lot of melasma. We get like 2 months, 3 months where you guys get sunshine all the time. We don't, and patients will run out, and then all of a sudden they didn't realize that their birth control or the stars aligned perfectly, and they go, oh my goodness, what did I do? What happened?
Yeah.
And you see them kind of come in covered, and watching them leave over time with treatments and educating, and they're just blossoming. They're glowing. They feel so confident.
Absolutely. And some of those patients, they've tried so many things.
Yeah.
Like, I've had patients here, melasma is super common in Miami, in the Hispanic community, and they come here and they're like, I tried every single cream there is on Instagram. I've tried 1,000 treatments around all of Miami. So when I see them, it's like, they don't even want to try. Because they're like, how do you,
Frustrated.
I don't even know if this is going to work. I've tried 7 different procedures. But that's a big one for us too.
Yeah.
How about a funny story?
Well, I think I immediately think of the patients that come in and haven't told their significant other that they're getting anything done. So one, they're like, I'm paying in cash, like I don't want a receipt, don't send me any alerts. And then they're getting their lips done and they're like, well, he can't know. And I'm like, oh my gosh, like that's a lot of pressure. Like I can't bruise you, you can't be swollen, you have
I do my job well,
Yeah,
there will be an improvement.
exactly. And so I think that always kind of gets me laughing a little bit, like, okay, we'll pretend that you bought $400 worth of sunscreen, like that's what you were here for.
And I'd say too, like how patients come in and they look at you and they're like, you look normal.
Yeah.
I thought, I didn't know what I was walking into. I was terrified. They expect this, they have this image of what they've seen on TikTok or a filter. So when they see you, they're like, you're really beautiful. You're like, well, geez, I heard by it. Thank you. As a compliment. And it breaks the ice of they now feel comfortable seeing a reflection of what your work is.
Yes.
And that's what makes them say, okay, this is the place for me. And on the flip side, sometimes they're like, I want this, this, and this, and I'm like, I don't do that. That's just not something we
Yeah.
do. So I can refer you someplace, but so it might go the other direction too. But I think the notion of we are supposed to look dramatic or just over the top, and we don't, or at least our practices we don't, and I think that's a refreshing.
They're
like,
like fear of
"Hey,
patients, right?
This is comfortable.
Absolutely, but it's funny because if we put ourselves in the other part, right?
Mhm.
Like they're injecting my face later today, so if I want to look like you guys, okay? But if you put yourself as a patient, I feel if I was going to a spa now as a provider, I would say the same thing. I would be like, okay, don't make me like people on Instagram. Please don't put a whole syringe. Okay, a little bit. Don't let me see in between.
Yeah.
Okay, let me grab the mirror. And whatever I hate of what patients tell me,
That
I
would
would
be
be
you.
exactly the same. I would be like freaking out just because it's my face, and we see like so many things on social media. But that's a good point because I had a patient the other day tell me, well, I don't want a lot of Botox. I just like you, and I'm like, dude, I have 60 units
exactly.
on my face. You can see me. I only move my eyebrows and my mouth. That's it. I
Right.
want it static. If you could debunk one myth about aesthetics or skincare, what would it be?
I don't know. I have one that it's easy, that you're just injecting. You left being an endocrinologist. You left being family medicine. I left being an NP to just inject. And it's like, that is not what it is. It is so much. And when you are the business owner, it's a 24/7 job. You are every hat, every single hat you wear in that practice. So I'd say the thought that it's easy. Is it doable? Absolutely. But it is hard work. This is not for the faint of heart. This is not for a quick side gig and you want to make some extra dollars. You got to be invested and you have to be passionate. And if not, your patients will pick up on it. Your results will show it. Your practice won't be as stunning as something like this. This is your passion. You can tell how much time and work and energy, and this is you. It represents you. So it's not easy, but it's doable. You just have to put the work in.
Yeah, amazing point.
When I was hearing the question, I was thinking of it like from a patient standpoint. Like,
Oh.
what is a misconception that a patient might have?
Yeah.
And so I kind of go back to the idea of, like you were saying, like you're not going to put a whole syringe in me. I'm like, a whole syringe is a fifth of a teaspoon. Like it's the tiniest little amount. Like people think a whole syringe is going to transform their face and make them look overdone. I'm like, it is expensive to look overdone. Like that's probably 12 syringes of filler, you know? So I think that's a big myth. Or like you were saying, I want a little bit of Botox like you, and you're like 60 units. That's not a little bit of, I think that's the biggest misconception, is just that the overdone or bad cases that they see are the norm, and it's, the ones that
they're easy to accomplish.
yes,
and
the
you're
ones
like,
that you
"No."
don't recognize as having Botox and filler actually have Botox and filler well done.
Yes.
Yes.
Yeah.
It's the same, for me, if I see, for example, a 65-year-old that has never had anything, and you come in and you're like, okay, either do I need fillers or do I need a laser? And you're like, you need both.
Yeah.
It's not because I'm selling you, it's because I tell them, imagine people that start when they're 28, the whole money they spend until they're 65
You
to
need to
look the
spend
way
now.
they look, you need to
Yeah,
spend now.
yeah.
That's basically what it
It's
is.
true.
You know, they talk about J-Lo being 50. I'm sure she's had treatments that are not even in the US yet,
Yeah.
and they're
For the
experimental.
last 30 years.
You know, so you cannot compare yourself to TV because they don't say what they are having
No.
done, but they are definitely getting
Yeah.
something.
For sure.
We don't know if it's injectables, it might be lasers, it might be massages, I don't know
Yeah.
what it is.
Yeah.
But they look like that because of a reason.
Horseback riding, wasn't that?
Yeah.
Martha Stewart.
Martha Stewart.
Oh, there's horseback riding.
Yeah, sure.
Yeah.
Yes.
That's what 80-year-olds look like, that horseback ride.
Well, you know, it's funny because I saw a video the other day of her on Instagram, and she's like, yes, I think it was,
Demi Moore, Drew
she's
Barrymore.
single, Drew Barrymore, yes.
We need to play charades.
I know,
That's
I know.
interesting.
I can give you very liberal information. Yeah, talk show, blonde.
In a movie,
that's
and
it.
single. Okay.
So she was in the Drew Barrymore show, and Drew Barrymore's like, you know, like you're saying you're dating, like what do you do? And she's 80. She
Yeah,
looks
she-
amazing.
Yes.
And she's like, well, you know, yeah, I just had sex yesterday with a younger guy, and yeah, I just sent him on his way this morning. And I'm like, I need that amount of confidence in my life.
Yeah.
Like,
And
seriously.
that amount of honesty too,
Yeah.
right? Like,
Well, partial honesty.
yeah, great.
And that's, I feel, my point with that story is like, aesthetics do something to you and your confidence and the way that you talk, where if you feel like you don't like how you look in the mirror, you're never gonna be like that honest and say,
Yeah.
yeah, I mean, I went out with a younger guy yesterday, who cares, you know? So whatever she did, whether it was the horse or the surgeon,
Yes.
she looks amazing. Okay, this is a good one for all of you who have a med spa and you kind of want to go above and beyond on your experience. What do you think sets apart a truly exceptional med spa experience from a merely satisfactory one?
I think being patient-centered, so that comes from the first email, the first phone call, what your website looks like, what your Instagram is. There has to be a nurturing touch to it where someone feels drawn. They feel like they can trust you. There's this compassion. And then when they walk in the door, they're the center of your attention. Whether it's someone offering them water, coffee, here's the restroom, here's a cookie for Valentine's Day. It's the little things, because those are what make me feel good. I
Yeah.
think if you think about your favorite store, why do you go there? Well, when I walk in, they say, hello, you know, Mrs. Freese, hello, you know, and you're like, oh, they remember me, they know me. Well, it's
Yeah.
the personal touch. They're having an appointment, so of course they know your name, but say it. And when they have that personal touch, you all of a sudden become connected on a deeper level, I think. And that to me is much more satisfying than if I walk into, you know, Louis Vuitton and no one even looks at me, I'm like, okay, well, I'm a customer, why is it?
Yeah.
But if you come right over and, oh, I love your shoes, what can I'm like, oh, you show me to the closest one. It does, so, you know, think about how you want to be treated and then do that back to your patient.
I agree, like that personal touch, you know, remembering that the last time that you saw them, they were going to a wedding or they were going on a vacation or they just got a puppy, and like trying to connect on that. And then like we were talking about earlier, I think when you are passionate about what you're doing, it translates into the treatment and the experience that your patients are going to have. And just, I think, you know, the toxins are the same, the lasers are the same, the fillers are the same. It's the experience. It's the personal aspect of it that will set you apart.
Right. And what we do are costly treatments, you know, it's not like they're
Yes.
coming and getting something cheap.
Yeah.
So I feel they are expecting some sort of treatment ahead of time, and if you don't provide that, I think that you're not gonna succeed in this industry.
Correct, yeah. And it's different than traditional medicine. You know, when you work in the emergency room, people have to come see you. They're dying. You're saving their life. This is a choice.
Mhm.
Treat it like that. They can walk out your door and go down the street to someone else. So you need to treat them like they are the most important thing. And there's gonna be times where you don't want to. And the patient's difficult and you're like, oh my goodness, we've gone over and over and over. And I think it's also okay to say, I might not be the injector for you. This might not be the practice for you. Because then you start to lose your happiness because you can't meet their expectation, whether it's unrealistic or just not something you do. I think you also have to be honest with yourself to say, I may not be the person for you, but let me get you to someone who I think can help you. So if you're happy, that's also going to show for the patient.
That's a good point, because it's so much more than just getting a business, you know, like you said earlier, for us as entrepreneurs, your mind is on, at least for me, 24/7. Like I literally send the girls Instagram posts at 3 a.m.
Yeah.
They're like, what were you doing? I'm like, I'm just there, just
Went to the
scrolling
bathroom.
for ideas, and yeah, I can't sleep. I'm like thinking of my next promo, or thinking about the next event for the patient. So it's something where if it's gonna take out your peace, then you know
Yes.
what? Let's just jump into the next thing, because it's
Yeah.
not even worth it. So we tend to finish the podcast with a quote of the day, but instead of doing a quote, I thought of asking you ladies, as professionals in the industry, what advice would you give to individuals considering pursuing a career in this field? Not do it. No, kidding.
We were talking about this earlier. I think the most important thing is the training. I think you have to enter into the business well prepared, and you know they'll offer a weekend course of Botox and filler where you've done a quarter of a face and you're on your merry way. And I think that's a recipe for disaster, right? Like if you go out and start your business injecting after doing a quarter of a face, then it's not going to serve you well. So I think the more education and training that you can get up front, but also continuing that throughout the time that you're practicing is crucial. So I think the training and the education is the best investment.
Absolutely.
Looking back, I wish I had done kind of a 1 year, a 3 year, a 5 year, a 10-year plan. Like I'm still kind of going through, like, I don't know, you know, what is my time? And I know it now going into my year 7, but to figure out kind of where you expect yourself to be. I think comparing, what is it, like your chapter 1 to like someone else's chapter 10, that's not fair to you. That's really not fair to yourself. So I think you have to make right from the beginning what your plan is, where you want to go, and then change it. That can absolutely happen. But if you go in thinking you're going to have this year 1, and maybe you do, and that's awesome, but most 99% of you aren't going to, and that's okay. That's where you start. And then make good friends. Like these are the people that, the nights where you do have difficult patients or moments, or you've made an error and you're helping a patient. I mean, I think the two of you have talked me out of selling my business a couple times, because it's like anything else. You get frustrated and you're like, maybe I'm not good. And it takes really good friends to say, you are. Go to bed, wake up tomorrow, it's a new day. Every day is a new day. So leave it here, cry, and then tomorrow you're back on your feet, you gotta move again.
Yeah.
And I think you had made a good point earlier when we were talking too, if you have the option to have a mentor, that is huge, because they've gone through it, they've made the mistakes, they can keep you from making those mistakes on some level. That's been a huge help, just establishing, having that relationship.
For me, those are amazing points. I think for me, it's a lot of like, as a business owner, don't take what you see on Instagram as they're doing amazing. Because I feel not only in our personal lives, now that I'm single, I look at some of my friends' lives and I'm like, oh my God, they're traveling and they're doing this and what a beautiful house. And I feel that can deviate our mind and deliver frustration for what we have at the moment. And that happens as an entrepreneur and a business owner, where you look at some of these clinics and they have 15 staff members and they have a 10,000 square foot, clinic, and you're like, oh my God, they're in their 3rd year. What am I doing wrong? So don't let that discourage you, because it's gonna be more of like, the location where you're at, how much competition you have, how high you can price your products. And you never know. I mean, some of those clinics next year, they're closing. So you never know what struggles they have with their staff, what struggles they have with their patients.
That's on social media.
Yes, exactly.
Instagram versus reality.
Absolutely. So for me, it's more of like, just do your thing.
And do it well.
Yes.
Do your thing and do it well, and the
That's
rest
what's
will
gonna
kind
keep you.
of fall into place.
Absolutely, yeah. So, well, I want to thank you both, ladies.
Yeah, thanks for having us.
These are such professional and well-spoken women that have favored their way into success, not because nobody gave it to you. You guys have worked hard. For me, I get very emotional because they have been a lot of support to me through my very hard years. So I love you both.
you're very nice.
I know. No, they have been amazing to me, and I am very lucky to have you guys as my friends. And I'm excited for this weekend. Thank you for coming down, and I hope we can do this again.
Yes, we'll do it.
Thank you guys for listening, and we'll be here next week.